Nigeria's 40 million women of childbearing age between 15 and 49 suffer a disproportional high level of health issues surrounding birth. While the country represents 2.4% of the world's population, it currently contributes 10% of global deaths for pregnant mothers. And despite recording successes with the uptake of infant vaccination, eradication of polio, amongst others, Nigeria still battles with a high rate of infant and maternal mortality, with only 1.8% of primary health care facilities in the country having the minimum number of required skilled birth attendants.
To support the strategy's implementation.
To check this, the federal government has introduced a community-based health research, innovative training and services program, CRISP, that will leverage on the rural posting of resident doctors from teaching hospitals to boost and guarantee the quality of care at the primary health care centers.
In the last 4 years, we set out very clearly that we had a 4-point agenda at the National Primary Healthcare Development Agency. 1, to eradicate polio. 2, to improve routine immunization. 3, to improve the financial management processes at NPHCDA. And 4, to revitalize primary health care. We've been able to eradicate polio. We've been able to increase routine immunization from 33% to 57%. We've been able to restore the global standards when it comes to financial management processes, revitalizing primary health care. This is work that is in progress. We've been able to make sure that at least 6,000 of the initial 10,000 that we've identified are now functional. We have about 25,000 primary health care centers. So there's still a lot of work that needs to be done.
While medical brain drain continues to pose a challenge to the nation, with over 5,000 medical doctors moving to the United Kingdom in 8 years, the remaining doctors prefer to practice in secondary and tertiary hospitals in urban areas. Now, with the CRISP program, the government plans to engage over 3,000 medical professionals in 6 months. Doctors and midwives from all tertiary healthcare centers will be trained and deployed to various primary healthcare centers, especially in rural areas, which would go a long way to ensure that Nigeria attains universal health coverage for all, especially rural dwellers.
We do have a problem of internal brain drain. Internal brain drain from the rural areas to the urban areas. So brain drain is not only when you go outside, but it's also a problem that is domestic and which we must find ways of making differently. CRISP is a new partnership among the National Primary Healthcare Development Agency, tertiary hospitals, federal medical centers, the state primary healthcare boards, and the local governments. And I'm happy that the local government is here because they are very, very close partners here in realizing this. And of course, the communities themselves.
Amaka Ude Walker, Arise News.